Welcome to the Hauser Neck Center here in Fort Myers, Florida. I was just using my Eustache, and then when I was using it, obviously I closed the one nostril. Then I swallowed 3 times. The third time my ear popped, the other 2 times it didn't. And then if I do it on my left nostril, all 3 times it pops. So I have a little bit of eustachian tube dysfunction on the right side. If you guys want to check it right now really quickly, if your eustachian tubes are opening or closing. So let's do this, like close your nose, then swallow 3 times and see if you get a pop equally on both sides. So swallow 3 times. Okay, so let's just say you're like me, the one side pops really good and the other side doesn't pop so good, or it doesn't pop at all, then you have eustachian tube dysfunction on the right side. That would be my opinion, and that's actually pretty accurate. So some people, what they do is they manipulate their jaw, or they do different things to try to get their ear to pop. They might do this, they might do the Eustache. Like for me, just doing that, now I can hear better out of my right ear, I kid you not. So today we're just going to talk about ear popping, and it's actually a much more common problem than we might think. Think of all the kids in America who have chronic ear infections and then they have to get tubes. Like what actually does the tube do? So they're putting a tube in the tympanic membrane to what? To drain the ear. So what I just did, when I did this, my eustachian tube opened, then I drained my ear. So if you have ear fullness on one side and you don't have it on the other, or you have ear fullness on both sides, you know, you have an ear drainage problem, and that's called eustachian tube dysfunction. And it can cause decreased hearing, it can cause ear pain, it can cause dizziness, and it's associated with cervical instability. It's associated with cervical dysstructure and TMJ. So today we're going to talk about all those things. So what is ear popping? A sound heard in the ear when the eustachian tube opens. That's what we were just doing. It equalizes the pressure in the inner ears with outside pressure. So you know when you go up an airplane or down an airplane and then your ears can't equilibrate, or you have to chew gum, or your ear starts hurting? That's the eustachian tube. Like you're trying to chew gum or do something to get your eustachian tube to open to relieve the pressure. My nephew Kyle, we went down to the Keys. This is when he was trying to get certified in scuba. Unfortunately, he had a sinus infection. So the first day when we were doing it, it was terrible. Like he just had his ears hurt, his ears hurt, his ear hurt. So we actually couldn't do the scuba diving certification, because when we would go down there, he just couldn't equilibrate and it was just too much pain. Typically the eustachian tubes that cannot open or close properly was thought to be due to allergies, a cold, sinus infection, or polyps in the nose, and occurs commonly when there are changes in the outside pressure, such as when scuba diving or flying in an airplane. What isn't as well appreciated is how ligamentous cervical instability and cervical dysstructure can interfere with the ear popping or the eustachian tube opening or closing. If you have a cold, if you have swelling of your tonsils, like that can close off the eustachian tube. So I'm not saying that sinusitis and all these things can't screw up the drainage of the inner ear, but most people don't have a chronic sinus infection or a chronic tonsil problem, but they can have a chronic ligamentous cervical instability issue or a chronic breakdown of the cervical curve. So this is basically, that's the hearing organ, or the cochlea. That's how you hear. Then there's a eustachian tube that goes in the middle ear, so that's the middle ear. This is the ear, sound comes here. There's the tympanic membrane that vibrates, that causes these bones to vibrate. It eventually goes to the cochlea and then you hear. Well, you really don't hear till that electrical impulse then goes to a certain part of your brain. But if fluid accumulates in the ear, in the middle ear, guess what? It's going to stretch the tympanic membrane, and that's going to cause you a lot of pain. So what they do in kids, they put those tubes, they put those ear tubes, but a better approach would be is, why is this fluid accumulating in the inner ear? So in kids, often it's just crappy eating. It's like they're allergic to dairy, they eat junk, you know, so they get an inflammatory reaction in here. So the better approach is have the kid eat a healthy diet. Then if the kid's been looking at a tablet since they were born and their curve is all cockamamie, the treatment is get the kid looking up, go to a pediatric chiropractor, or get the kid in taekwondo or ballet or something where, or get their computer screen up, or don't let them look down at tablets, look up at the TV, or get involved in sports where you're looking up. And so long story short is the eustachian tube, there's certain muscles that need to contract to open up the eustachian tube. The stapedius muscle, the tensor veli palatini muscle, and veli palatini muscle, those muscles are innervated by cranial nerve 5, 7, and 10. Nerve impulses can be blocked to those muscles by problems in the neck, and when those muscles don't contract, your eustachian tube doesn't open, and then you can get fluid accumulation here, causing all kinds of problems. So the function of this eustachian tube, which is a connection between the middle ear and the throat, is air is necessary in the middle ear for proper sound propagation and protection from loud sounds. It allows air to be put into or taken out of the middle ear to equalize the pressure on both sides of the tympanic membrane. The canal by which secretions and debris can be removed from the middle ear into the throat. Basically, there's ways to get the eustachian tube to open. Like, so I just showed you, there's things like vibration does it, holding this and swallowing. But again, if you have a significant neck problem and these simple tips won't work, then you have to get an evaluation to see if you have any sort of cervical instability, or your curve is abnormal, you've lost the lordotic curve, or you have misalignment. So Valsalva maneuver, it's discussed there. There's various maneuvers like pinching your nostril closed with your fingers while swallowing, which we talked about. Some people use nasal decongestions. The Frenzel maneuver, you pinch the nose closed and use the tongue to make a clicking or a K sound. There's various devices you could use. For instance, somebody just feels like terrible, like they're dizzy, ear pain, ear fullness, it's driving them nuts. It's not a good idea to continually manipulate your jaw, you know, to open up your eustachian tube, because you're just going to make it more and more loose. Just like cracking your neck over and over again, it's a terrible idea because you're just making yourself looser and looser and looser. And there can be a time where you crack yourself, where you do something and you injure yourself so much that you actually get neurologic injuries. So don't do that. The reason why I have this on here is there's all kinds of inexpensive things that a person can do to see, for instance, if the vagus nerve's an issue. So that's the most common reason we see for eustachian tube dysfunction. So a person can get a pulse oximeter that checks oxygenation and the pulse. So say you have a pulse ox on and you hold your neck this way, and all of a sudden the pulse goes up, like it goes from 72 to 90, then you know that that motion is inhibiting the vagus nerve's ability to slow the heart rate down. And then heart rate variability, so getting a heart rate variability monitor, that can tell you the imbalance of the sympathetic system and parasympathetic. The parasympathetic is the vagus nerve. That's what's needed for proper eustachian tube opening and closing. Is my jaw part of my systemic symptoms? When you open your jaw, does it open and close normally? And then, Do you feel a clicking on one side or the other? So clicking of the jaw is completely abnormal. Clicking means that you have instability. If you have instability of the jaw, I'll show you how some people have a connection between the jaw and the inner ear, and that's why they can get all kinds of dizziness, vertigo, tinnitus. So do I chew on primarily one side of my jaw? So when you chew food, it's supposed to be both sides, and often when you have TMJ, the person's preferentially chewing food on that side. So the first thing you have to do is chew food on the opposite side. So if you have right jaw pain, my advice would be is chew your food on your left side. When I open my jaw, does my jaw go crooked? That's again a sign of temporomandibular joint instability. Do I have facial tension or pain on the side of my jaw that is clicking? Do I have tinnitus, ear fullness, mostly on one side? I should say tinnitus it can often be from eustachian tube dysfunction or compression of the jugular vein. Both of those are treated by curve correction, prolotherapy, and sometimes adjustments. So ways to figure out if the jaw is an issue. We talked about, if the jaw is crooked when a person opens their mouth. So also if chewing or talking increases the symptoms of fullness, decreased hearing, tinnitus on the one side, dizziness, then if that's increased by moving the jaw like talking or chewing, that is a sign that there's a TMJ issue. Recently I had a crown placed and all of a sudden I got, even like you guys saw me today, so that was just like 2 weeks ago or 3 weeks ago. I'm still kind of recovering, and the crown was placed on this side, on my right side. So you got to realize for an hour or whatever, your jaw's open in a weird sort of way. So if you've had an increase in symptoms after a dental procedure, probably is related to the TMJ. People pop or manipulate their jaws because it reduces symptom. That's another sign that there's a jaw component. Purposely placing the tongue at the top of the mouth and opening the mouth a little, thus negating jaw muscle contractions, do the symptoms decrease. So if you put the tongue slightly on the roof of your mouth and you relax and you pay attention, if head fullness, tinnitus, after a minute or two, pain, if those symptoms go down, there is a jaw component. So there are people who need to wear a splint, some kind of a splint. We're starting to use in the clinic here the Myo brace, MYOBRACE, because it trains the tongue. So you guys might want to look up that. So in other words, if that maneuver decreases the symptoms, then you have a bite or a jaw issue associated with your symptoms. If you go on a juice fast, so forces on the jaw are minimized, do the symptoms decrease? So that would be a sign. And lower forces on jaw that pops by chewing food on opposite side, do the symptoms improve? That's what I was saying, like if you chew the food on this side, do the symptoms on this side go down? That's the sign that a jaw is a problem. So this is your jaw, that's the TMJ, you actually have a disc. So the popping, when you open and close your jaw, when the jaw pops, that's your articular disc snapping back and forth. It's not supposed to snap back and forth. Yeah, see how there's ligaments associated with the disc? So if you open your mouth and it's click, 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 click in the jaw, that means you have ligament laxity and the disc is popping forward, and that's what's causing that pain. So you're going to need some prolotherapy. There's a discomalleolar ligament. That ligament connects the TMJ to the inner ear or the middle ear, and that's where you can get all kinds of things such as eustachian tube dysfunction. By this ligament, there's a connection between the jaw and the middle ear, and that can cause eustachian tube dysfunction. There's obviously other things that are in this region, such as the hyoid bone. If you have TMJ for a long period of time, there's tension on the stylomandibular ligament, then that ligament can get calcified, causing Eagle syndrome or an elongated styloid, and that can start compressing the jugular vein, the cranial nerves in this region. And that just shows the stylomandibular ligament right here. So if you have TMJ, the stylomandibular ligament is going to continually try to get your jaw back, and then that can cause an elongation of the styloid bone. In the office, we do cone beam CT scan. We look at the jugular veins and the vagus nerves, and we even can have the person manipulate their jaws and see what happens to the vagus nerve and the jugular vein. This is our cone beam CT scan. You get beautiful views of the jaw, the neck, and then of course we can have the person retract their jaw and just see what happens to their anatomy. This is, the person is going like this, and again we're just seeing how the anatomy changes, and is there a jaw component to their headaches, the increased brain pressure, the jugular vein compression. And again, this just shows that sound enters the ear, goes to the cochlea, then the electrical impulse then of course goes to certain parts of the brain, and then you actually hear. So you could see where if there's fluid in the middle ear or the eustachian tube can't regulate the pressure, where somebody could get just like, I just feel like I'm on a boat, I feel terrible, I'm dizzy, I can't hear. If they can find something that can cause the eustachian tube to open, they feel much, much, much better. So the balanced ear pressure, see there, the pressure inside the ear and outside the ear is exactly the same. When you have fluid in the inner ear, there's just so much pressure in the ear, and then there's a disequilibrium of the pressure between the inner ear or the middle ear and the outside pressure, and they have pain and they feel terrible. So remember I said that there's a connection between the TMJ and the ear. So ligamentous structure connecting the malleus in the tympanic cavity and the articular disc and capsule of the TMJ occurs in 25% of the people. So if you're somebody who thinks a lot, you're an artist, you're a little bit emotional, we tend to contract the muscles of our face more than the average people. So we're the people that tend to have bruxism or clenching of the teeth at night. So you might say, well, geez, doc, how do you get over your clenching? Well, years ago, I researched the work of Dr. Jacobson, who wrote the book, You Must Relax. So way back when in the 40s and the 50s, Dr. Jacobson discovered that you fall asleep the moment your muscles of your face relax, and whenever you have a thought, you have tension in the muscles of your face. And I noticed that the people who had sleeping problems were the patients of mine who they tended to be right-brained, artsy, they tend to think more than the left-brainers who are analytical, organized, who are doers, not thinkers. They would go to bed easily, like they wouldn't be bruxers. So I thought to myself, well, how can I be like them? So what I started to do was, when I did stinkin' thinking, so in other words, when I started, like after work when I'm going home, I should just be like listening to music and watching the road. So when I started to like think about this patient and that patient and all these different things, I would ask myself, what does God want me to do right now? And I just started doing something. So what God wanted me to do was pay attention to the road. You know, there's a yellow car. Ooh, I like that yellow car. A red car. And I'm listening to music. So I started to do something. Then all of a sudden, after 3 or 4 months of doing this, all those thoughts left. And man, did my head get clear. The bruxing went way down. You know, and all this stuff, a lot of this stuff got better. So that might help somebody. So if you're somebody that has way too many thoughts, my advice would be is take, like the Bible says, take every thought captive. So what you should do is, when you have yourself going to the dark side with all these stinking thinking, just ask yourself, what does God want me to do at this particular moment? And if it's cooking dinner, just pay attention to cooking dinner. So Tension on the discomalleolar ligament causes movement of the malleus. This may explain why some cases of TMJ syndrome have symptoms consistent with eustachian tube dysfunction, including ear fullness, tinnitus, pain, and dizziness. Probably works in conjunction with the anterior malleolar and sphenomandibular ligaments. So again, there's definitely connections between the brain stem, which of course is affected by upper cervical instability, and the eustachian tube. And again, there's lots of different devices that can open up the eustachian tube, and for anybody who believes they have eustachian tube dysfunction, I would recommend trying some of these maneuvers, these gizmos. So why don't I just end this video, and I'm gonna exercise my muscles that open up my eustachian tube. Have a great day.